Hello, my name is Lucas Mngodi, and this is my research project for culture and medicine. I based my research project on Alzheimer's disease. Prior to starting, I just wanted to say I'm a little bit sick, so my voice might sound pretty raspy, but I'll try my best. Before diving into my Alzheimer's research project, I just wanted to give a little bit of an overview of what Alzheimer's disease entails and how it was found. It was first observed by Dr. Alois Alzheimer, a German psychiatrist, in 1906 when he was studying a female who had memory deterioration. Along with memory deterioration, other symptoms include mental decline, difficulty thinking and understanding, confusion in the evening hours, delusion, inability to recognize common things, aggression, agitation, difficulty with self-care, meaningless repetition of own words, apathy, anger, mood swings. Along with those things, other symptoms include paranoia, psychosis, depression, hallucinations, jumbled speech, and the inability to combine muscle movements. The caretaking process can vary from patient to patient. Some methodologies of treatment include memory and cognitive stimulation, behavioral therapy, and medication. Now you may ask if there is a cure, but unfortunately, there is not. However, these forms of treatments and being surrounded by loved ones helps the deterioration of the brain that Alzheimer's causes to slow down and not be as destructive. The photo to the right of the slide shows normal brain activity with mild cognitive impairment, and brain activity with someone who has Alzheimer's disease. It's clear to see how destructive this disease is and what it does to the brain. The research question that I approached and answered in my research project was, how has knowledge of Alzheimer's disease and other neurodegenerative disease progressed throughout the years, and how has this helped with treatment? To search for answers, I looked at many scientific literature and journals to gather information on this disease and its forms of treatments. Both qualitative and quantitative data were observed to get a broader idea of what this disease entails and how to combat it. When conducting my literature review, I looked at many types of studies to get a wide-angle lens view on this disease. These studies include anthropological studies, biomedical studies, interpersonal and therapy studies, and studies that looked at the effects that treatments have on Alzheimer's patients and their caretakers. Along with that, these studies range from over 30 years ago all the way to today to get an idea of how Alzheimer's research has progressed in order to fight this neurodegenerative disease. The bottom picture is a photo of Dr. Alzheimer, the doctor credited with finding this disease, whereas the top picture is a picture of the protein known as beta amyloid. This protein destroys synapses and is highly implied as the reason for Alzheimer's. In my literature findings, I looked at many different studies. The first being an anthropological study looking at an anthropological perspective of Alzheimer's disease, which was posted in the Geriatric Nursing Journal. Looking at Alzheimer's from an anthropological view allows for three different perspectives to be looked at: the domestic and family context that Alzheimer's has, the biomedical discourse of Alzheimer's, and the loss of self and social death of a victim of Alzheimer's. Looking at Alzheimer's from an anthropological view allows for different social and cultural contexts to be compared on how the management of Alzheimer's has changed and continues to progress. The second piece of literature that I looked at was called The Burden and Coping Strategies of Caregivers with Alzheimer's Patients, which was posted in Family and Healthcare. It showed that there is a correlation between the health of a caregiver and the sense of burden they must endure when treating someone with Alzheimer's. Given that Alzheimer's is a neurodegenerative disease, people no longer know who their loved ones are, and sometimes even themselves. With that being said, it takes an emotional toll on caregivers, and their sense of burden continues to grow as time progresses. Out of the 7 pieces of literature that I will be discussing, the third one looks at a biomedical approach of the 3D structure of Alzheimer's. By that, I mean the protein that causes Alzheimer's. This protein is called the amyloid B1-42 fibril. It describes the beta amyloid fibrils that is located within the central nervous system and how it affects the brain. These clusters of fibrils result in the impairment of cognitive functions. Interestingly enough, diseases like Parkinson's, another neurodegenerative disease, also have clusters like this that impair the CNS, except that they are different proteins. Now you may ask, how do they find these proteins? Well, chemistry methods like NMR were used in order to find and determine the composition of these protein fibrils. This biological find connects the biology and physiology behind Alzheimer's. The next piece of literature looks at interpersonal stories of Alzheimer's patients and what they must endure. It also looks at the mythology of reality therapy, which helps someone with Alzheimer's maintain a sense of reality. This project showed the world that a person with Alzheimer's reality is actually an altered reality based on the person's life experiences. They might remember old memories and bring them back in times where they do not fit in current time or the chronological timeline of their life. The next piece of literature that I looked at to answer my research question was called A New Rating Scale for Alzheimer's Disease. Ironically enough, the study was conducted in 1984, which is about 35 years ago, so it's no longer new, but it still stands today. The Alzheimer's Disease Assessment Scale includes questions and memory activities to test for the functionality of cognitive abilities one has when suffering from Alzheimer's. People of all ages were looked at during the study, and as expected, those who are older have been impacted by Alzheimer's more than those who have been newly diagnosed or younger. The next piece of literature that I looked at was a training program to help caretakers of Alzheimer patients control their anxiety and increase self-efficacy, which allowed their emotional toll and their feeling of burden to lower. 4 relaxation techniques were taught, one of them being breathing exercises. After the study, it was proven that self-efficacy for caretakers rose and their feeling of burden lowered. The final piece of literature that I will be discussing was posted in the Journal of Clinical Psychiatry. It was a study done in 1987, so it is kind of outdated, but is still used today. It researched the behavioral symptoms in Alzheimer's disease and the treatment behind these symptoms. Out of the 57 test subjects looked at, thioridazine was used in 27, which is a form of medication. 56% of those 27 test subjects showed positive results. A larger sample size could have been applied in search of a more accurate result of the effects of this medication and other tests on Alzheimer's patients and their treatment. This would further validate the study. Looking at these pieces of literature have helped me come up with a conclusion. In conclusion, although no cure exists, we have come a long way since Dr. Alzheimer discovered this horrible disease. New treatments exist, which include memory stir techniques, cognition-enhancing medications, maintaining an emotional connection between the caretaker and the patient, and reality therapies which allow the patient to maintain a grip on their reality. Along with that, new relaxation techniques have been developed to lessen the emotional strain on caretakers. The bottom right picture is a picture of All's Place, a local Alzheimer's clinic in Gainesville that I have actually volunteered at. I'm very passionate about this disease, and I would love to find a cure one day. All this research has allowed for new methods of care to come up, new clinical trials to start, and over $259 billion in research. And by 2050, we will be at $1 trillion in research. I am certain we will find a cure one day. This last slide gives credit to the images I have used in this presentation. Most of them come from educational websites or scientific journals. Thank you for your time.